Alright, first we're going to begin by reassessing the patient and making sure that the perineal area is clean. Alright, after that is done. Hey, my name is Taylor. I'll be your student nurse today. Could you please verify your name and date of birth? Alright, thank you. Do you have any allergies? Are you allergic to shellfish or betadine? Okay. Alright, well today we're going to be inserting a Foley catheter. It's just going to relieve bladder pressure and allow us to examine your urine and do any lab testing. I'm just going to wash my hands and pull the curtain around. Alright, so I'm going to put my clean gloves on. And while I'm doing this, I'm going to raise the bed and lower the side rails. Alright, I'm going to reposition the patient. I'm just going to take this sheet off for you. And I'll move the patient's legs. Alright. And I'll also put the red bag over here without contaminating my sterile field. Alright, Ms. Jones, if you'll just lift your legs up for me. Thank you. Discard this. I'm not going to use that. Alright, so before I touch that, I'm going to remove my gloves. Now I'm going to put on my sterile gloves. Now I'm going to place my tray on my patient's stomach. I'm going to open my lubricant and apply it to the tray. I'm going to open my betadine solution. Have these so easy accessible. Alright, I'm going to get my urine container. I'm going to attach my syringe. Alright, and now we're ready to clean. First I want to start by cleaning. I want to grab right here. I want to clean like the distal labia. Discard that. The proximal labia. And then the urinary meatus. From top to bottom on all three of those. Alright. Without taking my hand from this, since it's contaminated, I'm going to get my catheter without letting the yellow tube touch. Get contaminated. Alright, I would lube the catheter. Making sure not to touch the vagina. Alright, and then once I see urinary output, I would insert another inch. And then I'll inflate 10 cc's into the balloon. While I hold this still. Alright, now I'm ready to remove this syringe. And I'm going to put this aside for later use. And then I would gently pull it and make sure it's anchored. Alright. Okay. Now I'm going to remove my soil gloves. And now that that's inserted, I'll hang the bag. Non-movable part of the bed, which this is. And then I will apply tape to the patient's leg. So, now what I'm going to do is clean up my supplies. And this would all go in my trash, but I'm going to save this for later use. And also, I'll need this for removing the catheter. So I normally throw this away, but I'm going to set it aside. Alright, after I'm done cleaning up, I'll remove my soil gloves. And then now I'm going to take a urine specimen. This is on the table. this valve, get my urine, and then once I'm done, I want to make sure I wipe this with an alcohol swab. Put that back. Alright, this is ready to be sent off to the lab. Okay. Once we're done inserting the catheter, I'll cover my patient up, lower his bed, raise his side rails, and place the call light within reach. And I would document that the patient tolerance, the size and type of catheter, the color and amount of urine, that the procedure was sterile, that I inflated the balloon to 10 cc's, and the date and time, and that I secured the tape to the patient's leg. Alright, that's it for the insertion of the catheter. Now I'm going to do the removal. Hey, Ms. Jones, my name is Taylor. I'll be your student nurse today. Could you please verify your name and date of birth? Thank you. Alright, today we're going to be removing your catheter, and it might be a little uncomfortable, but just try to do it as quick as I can. Alright, first thing I'm going to do is wash my hands, provide privacy, and I'm going to raise my bed to working height, lower the side rails. Alright, Ms. Jones, I'm just going to pull this out of the way. Put this into the patient and saver. So just lift your legs up for me. Thank you. Alright, to begin removing the catheter, I'll first take the tape off. Now I'm going to deflate the balloon. To the exact amount of 10 cc's that we put in. Alright. Once we've done that, I can just leave the syringe on here. And I will get, okay. Alright, now I will, okay, that's what, get gauze. And take this one. Alright, Ms. Jones, just relax for me. Alright, now what I would do is take the urine bag off, and I would measure and empty the urinary contents into the toilet, and I would dispose of the bag per hospital policy. Alright, now I'm going to clean it. I'm going to remove my soiled clothes. now I will lower my patient's bed, raise the side rails, place the call light within reach. And now I'll need to clean up. I'll get another glove, clean glove. Alright, I'm just going to cover you back up. And this would be before I would lower the bed and raise the side rails. Now I'll take this out of the room, dispose of it in the correct way. With my silver gloves. Alright, once I've covered up the patient, we've done that, I'm going to document the patient tolerance, the color and amount of urine, that we removed 10 cc's from the balloon, the date and time, and that the catheter was intact.